This is the Fertility Friday podcast, episode number 48. Welcome to the 48th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. If you've been enjoying the show, I would love it if you would take a moment and leave a review and a rating on iTunes. It helps the show to move up in rankings so that more people can find it. And of course, I'd like to say a special thank you to all the listeners who have left reviews already. I read all of your reviews and I appreciate you taking the time to let me know how I'm doing. And if you enjoyed today's episode, please stop by the show notes page and leave a comment. You'll find all the episodes at fertilityfriday.com/podcast. You can also find me on Facebook at facebook.com/fertilityfridays with an S. And you can find me on Twitter at fertilefriday. And as many of you know, I recently created the Fertility Friday Facebook group. It's the Fertility Friday Fertility Awareness Method Facebook group, actually. So just go to fertilityfriday.com/community and you'll be redirected to the group. And my plan with the group is to create a safe space for like-minded women to share ideas and discuss the fertility awareness method and support each other through the learning process. And today I'm excited to be joined by Sarah Panzetta. Sarah is a fertility awareness educator who has been charting her own cycles using fertility awareness since 1995. So that is 20 years. That's quite a long time. And she trained as a fertility awareness educator with Fertility UK in 2011. And like most women who learn this amazing method of natural birth control, she is passionate about sharing this knowledge with women. And in today's show, we'll be talking about the fertility awareness method, Sarah's experience working with clients, and we'll be delving into the topic of cervical fluid, as it's often an area where women have questions, especially when they first start charting their cycles. So without further ado, welcome to the show, Sarah.
Thank you. I'm pleased to be here. Thanks for asking me.
Oh, thank you so much for coming. So, Sarah, I did give you a brief introduction, but I'd love for you to fill in the blanks and tell the listeners a little bit about your background and what inspired you to become a fertility awareness educator.
Right. So my background, I learned about fertility awareness, 1995, like you say, which makes me feel very old. There was a pill scare, basically. And I knew that, the risks from it were quite low. But I was planning to get pregnant anyway, and a friend at work said, well, have you thought about using fertility awareness? And I thought she was I didn't really trust what she was saying, but I thought, I don't care if I get pregnant now anyway, so I'll give it a go. And so I borrowed a book and started charting and everything, and was amazed to find how easy it was to use and how effective. And so that was me really. And then I was, spoke to friends about it a bit, but I was quite nervous about sharing a lot of the information because I know, it can go wrong if people don't get the information right or if it's oversimplified, although obviously there's dangers with overcomplication as well. And so I decided to train as a practitioner, and it was something to do alongside my main work, which was being an NHS librarian. And then, I trained alongside nurses and doctors, and it was really, fascinating to find out all the different elements. And, you're asking me to talk about cervical fluid or cervical mucus today. And I think that's one of the things that when I learned on my own, I didn't really get entirely. And something about going through the training and talking about it a bit more made me appreciate it, how important it is and how useful. Although I do have a quite simplified approach to checking out. So, yeah.
Mm-hmm. Well, and after learning the method, I mean, obviously you stuck with it. So it seems like you're a satisfied customer. A funny way of saying it. But how has the fertility awareness method impacted your own life and your relationships and everything?
Oh, how's it impacted my life? So, I just love it. I mean, for me, it suits me really well. And I'm very, I like that I don't have to faff about going to the doctors all the time. I can just know myself when I'm fertile, when I'm not. And I think one of the things with it, which again I found from going through the training, was there's a bit of a danger with being too enthusiastic, and that's something that I do sort of watch in myself. And so I talk about contraception with women a lot. You talk about it, and then it's like, oh yeah, I'm using the coil, or I'm using the pill, or I'm using whatever it might be. So I've heard lots and lots of stories from clients and from women generally. And my bottom line is, if a woman's happy with their method of contraception, then they should, great, stick with it. But I want fertility awareness to be a routine option. That's my big thing, that you shouldn't be having to go completely like off grid and completely alternative to use fertility awareness. It should just be an option as routine as the pill. And I mean, I know the pill has its downside, and I have a lot, clients who've had an awful time with it, and I'm not the world's biggest fan of the pill, but I know it works for lots of women, and so I get a bit. One of the things that you might have noticed from my blogs is that that's one of my things, is that I'll go, I know, it's not like the pill is short of fans and marketing and all the rest of it. But if we go too far down it's all an evil curse route, then it's not really helping women, and it could be putting some women at risk. So yeah, and I think that's something else. I've worked with an abortion support network as well, and that's supporting women in Ireland and Northern Ireland who aren't able to access free, safe and legal abortion, helping women on a low income to access abortion services. And I know in Canada you have a fantastic, like the world's greatest abortion law. And that's, well, I don't know, but pretty good. I know I'm kind of going off message here maybe slightly, but I think one of the things with fertility awareness is that you do end up thinking about, so what would I do if I got pregnant? And I think that if we go too much down we must all be doing fertility awareness is for everybody route, then we could be putting some women at risk who are maybe in a relationship where they can't negotiate condom use, or different kinds of sexual activity at different kinds of the month. And so yeah, that's something I get quite passionate about. So yeah, but I love fertility awareness, and I think there's so much in it, and like you say about it being a fantastic health indicator, and the automatic thing about women just being put on it's like, you were talking about how you went to the doctor with menstrual problems, painful periods, and he felt like he was writing the prescription before you'd even finished talking. I was like, yeah.
That's how it was.
I feel that, and I've got an 18-year-old daughter, and I think there's something about having a daughter, going through all that stuff that just brings it all to life even more. It's like, yeah, I'm keeping going on this.
Yeah.
Even though it's it's something that I'm doing on the side. I've got a main job as well, and it's something that I do on the side because yeah.
Well, I really liked the way that you talked about it, because of course the pill isn't for everybody, but there are people who it's the absolute best option for them at the time. And the same thing with the fertility awareness method. Obviously, it's not for everybody, and it's not right necessarily depending on that period of your life. So there actually could be a period of your life where the pill is actually the best option for you, given everything that you've weighed. And then, you could shift to another period of your life where the fertility awareness method might actually be perfect for you. So I like kind of that balanced idea of, because I do a fair amount of pill bashing on the show. I'm not going to pretend that I'm a big fan of the pill.
I think it can handle a bit of bashing.
But at the same time, I also liked what you said about women should be happy with the whatever method of birth control that they're using. And I think that there's a lot of women who are unfortunately using the pill because they feel that it's the only option, and they're not necessarily satisfied with it. They might be a little bit nervous about some of the side effects that they've heard about, or they might be either knowingly experiencing side effects, or unknowingly experiencing side effects that are causing them stress in their lives and those types of things. And so I absolutely agree with what you said, that it should be one of the standard options, knowing that it's not going to be right for everybody, but it's something that at least should be put on the table.
Yeah. So. And not in a dismissive way, or you could use that. And I think that's quite often, women come to me because it's their final option, and it's like, it shouldn't be the final option. It should be a routine option. So yeah, absolutely.
Well, for anyone who's listening, maybe for the first time, maybe you could kind of, kind of like that elevator speech. Like if someone asks you kind of in passing, so what do you do? I heard that you do this fertility awareness thing on the side, and what's that about? How would you describe the fertility awareness method, kind of in your own words?
That's a good question. I think it changes all the time, really, how I describe it, depending on who I'm talking to some extent. I
Hmm.
do think there's something about the rhythm method. They've nailed it, haven't they? With that name, the rhythm method is just so everybody knows or thinks they know what it is. Whereas
Hmm.
fertility awareness method is just like, ugh, it's such a mouthful, isn't it? So I'll kind of say it's like the rhythm method, but it works. Or it's about understanding when you're basically, I suppose it's about understanding when you're fertile and when you're not, so that you can either avoid or plan pregnancy.
Okay. And then for even for yourself, when your friend mentioned it and you were kind of like, what is wrong with this chick? And it's so funny because I actually recently interviewed Toni Weschler, and she shared a really interesting story about how she learned the fertility awareness method. And it's kind of, she had the same reaction, like, why are these people teaching the rhythm method? So for the people that kind of hear about it and they're really skeptical, because of course, if you've only ever kind of heard about the rhythm method in passing, you don't really even know what the rhythm method is to begin with. And then the other thing is that you just think it's all hocus pocus. So, for someone who doesn't really know why it would work, what do you say to that kind of that question?
I say it's a highly effective method, that there's been some excellent research done of 900 couples. Well, the Frank Herman study, the fantastic Frank Herman study, that was done. So it's over 99% effective, so long as you can handle your fertile time. And that's the key thing. You have to be able to handle your fertile time, and you have to be prepared to spend a little bit of time learning how to use it. So if you can't do those two things, then it's not for you. But I think we can overstate how difficult it is to use on a day-to-day basis, and there's something about getting it down to a really minimal approach, which I quite like. And I'm kind of working on this like lazy woman's guide to fertility awareness,
Hmm.
which that's my approach, basically, as minimal as possible. And I think there's something about, when you first learn, it's brilliant because, you're learning all the hormones, and there's really fascinating stuff. And like you mentioned, Laura Brydon's book, which is excellent, loads of really, really interesting information in there, even though I'm not, I've written a review, but I think it's an excellent book. It's really well worth reading. And Toni Weschler as well. There's so many fantastic books about with, enormous amounts of information, and I think that has to underlie, whatever we do. But at the same time, we've got all these fertility apps coming up, which are just making it so accessible, and it's sort of, you don't want people to be put off, because I think in terms of that elevator speech thing, um, people just think, oh God, that sounds like way too much work. And
Hmm.
it's sort of trying to make it simple, because I think, you and I are enthusiasts, and so you can end up like learning so much stuff and wanting to convey so much stuff. And sometimes that's appropriate, because, people learn in different ways and people want different levels of detail. But what
Well,
was the
I
question?
like that idea because basically it sounds like what you're saying is that, and I think you're exactly right. People are put off by the idea that it just sounds too complicated. It sounds
Yeah.
like I have to take my temperature every day and I have to check for
Hmm.
cervical mucus. And you have this really interesting. I love the title of the one post you have that's like, do I need a speculum? So people think they need to like buy equipment and sit there with a mirror. And there's this whole big process, and it sounds like a lot of work, but I like to use random examples. And, when I was in my 20s, I decided I wanted to buy a standard car instead of an automatic because I wanted to learn how to drive, so I didn't know how to drive it. At first, it was pretty, like involved, but, now it's 6, 7, 8 years later, or whatever. It's just automatic. And the fertility awareness method is similar because yeah, there's a bit of investment in terms of your time and education. Like you got to buy a book. It's a good idea to go to a class if you can go to class, or work with a fertility awareness educator, which we'll talk about. But once you learn it, it's like basic routine stuff. Like
Yeah.
we all go to the bathroom every day. So all you're doing is adding a step where you actually look at your tissue or however you check. So it sounds like a lot of work, and there is a bit of an investment up front, um, but of course, it's really not for women who use it every day. It's nothing. It's kind of like brushing your teeth. It's nothing.
Yeah. Learning to tie your shoelaces, that's another one. I like that. 'Cause you're like, I can never do this. I'll never be able to learn to tie my shoelaces. And then you're
Yeah.
like, don't think about it. So it's yeah.
Yeah, no, it's funny. Tony Weschler used that example, and she said, like, if you had to write down the steps of trying to tie your shoelaces, you'd pull your hair out because it would sound so complicated. That kind of brings me to one of the questions I wanted to ask because we touched on how it's not a method for every single person in the world.
Mm.
So, I guess if you were to say like what type of person maybe wouldn't this method wouldn't work for, or you know, or a certain phase of a person's life, like do you think that there's some who is this method good for? I guess who are good candidates in a sense.
Good candidates. I'd say people who are okay with using condoms for part of their cycle. People who are okay. People who are, well, no, it's about being comfortable with your sexuality and comfortable with using different kinds of different approaches to, you know, keeping each other happy in bed. Basically, it's that kind of
Mm.
thing, really. But
Being open
that the
to
stuff
alternate sex practices. So perhaps being
there we
open
go.
to not having sexual intercourse for a couple days during your cycle type of thing.
Yeah. Um, the number one thing for me is that people are able to handle their fertile time, and I think there's different ideas about how long the fertile time lasts. And the Fertility UK approach is very much that this is 8 to 9 days minimum, and sperm life can be up to 7 days, and that's according to NICE guidance, which is, I don't know, it's like a UK standard thing. It's 7 days, and so the idea that it's only 5 days and that you can sort of squish it down to a shorter time isn't something that I'm very comfortable with. And so one of the things that I do go on about is that people have to be able to handle their fertile time, which means they need to be happy to use condoms, they need to be happy to abstain. Some people like to abstain, or they need to be happy with alternate sex practices. And so if that's not for them, then the method isn't for them. So there's that, and then there's also the sort of day-to-day, recording of information, which I suppose if somebody has a very chaotic lifestyle, or if the thought of, I don't know, lying in bed, taking a temperature in the morning, and then at some point putting it into an app, or when you go to the bathroom, not managing to notice whether you've got fertile cervical fluid, if that's just like completely beyond the pale for them, then it's not going to be for them. So
Mm-hmm.
yeah, I suppose. Um, what else? I suppose people who've got really, really irregular size. So quite often people with particular health conditions. Although of course, as you can use fertility awareness to help diagnose health conditions. That can also be a reason that people wouldn't want to use it. So say if they have spectacularly irregular cycles, and we know we can use fertility awareness with irregular cycles, but sometimes it can mean that fertile time, or potentially fertile time, is just too long
Mm-hmm.
for them to handle. Say if they've got a thyroid condition, there's just like so much cervical fluid and there's so much variation in cycle, then it won't be for them.
Mm-hmm. Yeah, if somebody has a really long time between ovulations, and so their body's trying to ovulate, so there's mucus and mucus and mucus and mucus, so then you have this really long fertile window. No, those are really great. That it kind of just gives a bit of context because, on the show, I'm not trying to say that everyone should use fertility awareness. I'm trying to say everyone should know it's a thing and then decide for themselves if it might be a good option.
Yeah, yeah.
And so let's talk a little bit about the role that cervical mucus plays in the fertility awareness method. So, why are fertility awareness educators always talking about cervical fluid? Why is it so important?
Because it's magic. It's no, it's why are we always talking about it? I think it can be one of those things that I did read a post somewhere where there was a health professional who worked in a sexual health or family planning, whatever clinic, And she said that she sometimes got queries from people who are asking about natural family planning, as she called it, or fertility awareness. And she told them that it involved checking your cervical mucus, and she said that's enough to put most people off. And that was basically how she was putting people off fertility awareness.
Lovely.
Was yeah, you have to check your cervical mucus. You won't like that. And I think there's something about the word mucus. I mean, Tony Weschler is very eloquent about this, and I think so. Mucus isn't a helpful word. I think fluid's a much better word, and I think also even cervix and cervical, because it's kind of like what's cervix? It's so I think, although I've changed my mind on this basically over the years, and I think actually vaginal fluid is a more helpful term in lots of ways, although I haven't necessarily updated that on my blog post, because it comes out of your vagina, and obviously the stuff that we're looking out for is coming from the cervix, and we know it's because of the rise in estrogen and everything, but it's just noticing what comes out of your vagina and not getting freaked out by it, because there's so many women, and again, it's a Tony Weschler story, but it's something that I've come across as well, that women just don't know that it's completely normal to have stuff that looks like raw egg white coming out of your vagina for a few days every month. And I would just love that to be a really routine part of sex education. And I know, some fellow practitioners have been in schools and have said, look, for sex ed for young women, and I know there's so many things to cover in sex education, but one of the things is vaginal fluid, and so yes, it's important for fertility awareness, and also for just for general body literacy and things, and of course, yes, we can use it for spotting when we're fertile, when we're not. Really useful for getting pregnant, although I think another thing that I've come across is with actually that was after talking to some GPs, family doctors in the UK, and they were saying that some women do still get freaked out about it, and we want women to be comfortable with their bodies and but that's not always the case. And so they were saying that actually ovulation prediction kits can be helpful for women who are who are either not comfortable with their body, or they're not noticing very obvious cervical fluid, because it can take a little bit of time just to get used to noticing it, really. And I've had one woman I worked with who got pregnant, and she said, I never saw any egg white cervical fluid. It never appeared, but she still got pregnant, she still had a baby. And so, it's kind of, you can overstate, it's this balance thing, isn't it? So, so yeah, it's important, but I think it's something that kind of comes secondary. I think temperature is, in lots of ways, the one. Well, I think the first thing is to actually start tracking, like first day of your period. Just keeping track of that is like number one, and then the next bit is temperature, because that's you can get a dodgy chart, and your temperature can be a bit tricky to understand sometimes, but that's like step two, and then it's a bit like step three is cervical fluid, or you see, I'm not saying it myself now, vaginal fluid, cervical fluid, whatever you want to call it, because it's something that, basically, I feel like it's step three, but it's also really, really helpful, and it is something that you can use, more or less on its own to work out when your fertile time is starting or finishing. So yeah, there we go.
Yeah, I think it's interesting because there's certain fertility awareness based methods that are actually mucus only, which is which just speaks to kind of the importance of mucus, because it is the presence of mucus that determines whether or not you can have a baby.
Yeah. Well, Billings, I was really interested to learn that he started off using temperature as well, or both of them started off using temperature as well, and then switched because they just felt it was too awkward. Maybe that was partly because it was in the days of mercury thermometers, which are a bit of a pain to shake down everything. My mum was a nurse. She used to have a very good technique for shaking down a mercury thermometer, which I could never really master. So hurrah for digital thermometers. But so maybe it was that, but for various reasons they decided that wasn't the temperature wasn't helpful, and that yeah, cervical fluid was the way to go. But Evelyn Billings, she had this thing about you don't even have to check it as you walk. She
Mm-hmm.
said, as you walk, you will find that on some days you glide. And I know this is.
Well, you know, it's really interesting because because I've spoken to so many different fertility awareness educators that have varied history, background in fertility awareness, have learned from different educators from different paradigms. There's a lot of different ways that the educators have spoke about it, and I think I think it's important to know that there are different ways that women actually observe their mucus, and I think that
Yeah.
you have to find the way that works best for you because each woman is different. So, and even a woman is different in her 20s versus for what she'll observe. So for you, having charted your cycle since 1995,
Mm.
you know, I'm guessing that your charts aren't exactly the same as they were when you first started charting because now you're older. Just similarly with me, when I was younger, my charts look different now that I'm older because I've been charting for about 12, 13 years. And so, certain things that may have been really easy, like if you have tons of cervical fluid when you're 22,
Mm.
and then now you're 37, and maybe you have fewer days, and maybe there's less abundance of it, or maybe there's more. But you see what I mean? You may have had a one way of checking that's not as effective, or not. You know what I mean? It just kind of
Yeah,
changes.
yeah. I think one of the things that made me train as well was because I'm 48 now. Hey, and when I turned 40, I was like, oh my God, my body's going to just like suddenly transform overnight, and I won't be able to use this method. And I was very interested in using the method through the menopause, basically, and perimenopause. And one of the things that I have spotted I mean, this is just myself, which, isn't the most scientific way of doing things, but is that, yeah, my temperatures have gone a bit weird. And so I've basically stopped using a thermometer.
Hmm.
And that might seem like the height of recklessness to admit that as a fertility awareness practitioner, but I think there's something about, because I've got relatively regular, I'm a, one of those annoying people with quite regular cycles, and basically cervical fluid is the way that I know when I'm fertile and when I'm not now. So I have basically switched to almost Billings approach, even though I am teaching um, the use of the thermometer, and I see that very much as a really fundamental thing to get your head around when you're learning. And I used it myself for years and years and years. Um, but there'll be a certain point maybe where you want to switch and drop using the thermometer and just rely on cervical fluid. So yeah.
Well, I think that speaks to kind of what we were talking about earlier, where at first it's a lot of information, but it's something that because you're not guessing when you're fertile because you're observing
No.
your cervical fluid. It's just that you've become very comfortable observing the pattern of your cycle. So I'm
Yeah.
guessing you're not sitting there saying, okay, well, on the 14th, because that's a totally different thing. Like at the 14th
Mm.
of the month is when I'm going to be, you're still looking at your fertility signs on a daily basis. It's just that
I
because
am. I
you've
think there's something.
observed 1,000 charts or 1,000, over the years, I'm just throwing out
Yeah.
that number randomly, but if
Yeah.
you've
Yeah. Yeah.
observed the same pattern of events 500 times, you're going to have a lot more confidence in being able to uh, know, like, do I have mucus today or do I not? Is this the end of my fertile window? Okay, I'll wait the certain number of days, and you know what I mean. Those things,
Yeah.
it's with practice, you just get better.
Yeah. And also, I think there's something about, although, as you know, with the rhythm method, it was just based on calendar calculations, and there is actually a role for calendar calculations. I know that, and a lot of women will have cycles that vary within quite a specific range. And so, if you know that your cycles are between, I don't know, 26 and 32 days or 26 and 29 days or something, and then to some extent you will be able to say, okay, it's day 14 of my cycle. I know that I'm actually ovulating quite early in my cycle generally, and I can tell that that's what's occurred from my cervical fluid. And so there's a place for calendar calculations as well, and especially if you can use them, when you're learning alongside temperature shift, and do the old During rule of temperature shift day -7. That's really helpful as well. So there is a place for calendar calculations, basically.
See, calendar calculations make me completely nervous, and I
Yeah.
think it does. It makes me so nervous, and the reason that it makes me nervous is because I don't like the paradigm that it's based on. I don't like the reason I don't like it is because women who are just learning, who
Mm,
haven't fully grasped exactly what's happening and haven't made that paradigm shift. There's a paradigm shift that has to occur for a woman to successfully use fertility awareness, in my opinion, because
yeah.
all of our ideas about the rhythm method that we've never been even taught what it is, that
Mm,
is how a woman enters into this space. And so she is often thinking, okay, so once I figure out how long my cycles are, I'll be able to figure out when I ovulate. That's kind of
mm,
the mentality that a lot of women go into this with.
mm,
But through learning the method, that's how they learn. Wait a minute, it actually has nothing to do with that. It's actually what I observe on a daily basis. And I'm actually not predicting anything. I'm
mm,
really observing what my body's telling me on a daily basis. And I think that when a woman grasps the method, she kind of makes that paradigm shift. So it makes me nervous to talk about calendar calculations because I feel like if women had no preconceived notions coming into fertility awareness, then you could learn it properly, really grasp it, and then add that aspect in for if it's helpful to you. Just like if you add in like breast tenderness or if you have a headache or something, it could be an additional sign.
mhm.
But if you don't have a good grasp of it, it supports that idea that okay, well, I'm just this is easy. I'm just gonna figure out how many days or what day of my cycle. You know what I mean? And
Yeah,
that's why
yeah.
it makes me nervous.
No, no, no. I completely hear you. I hear you. I hear you.
But that
Um,
actually brings me to a question that I wanted to ask you because at the beginning of the podcast you mentioned that when you learn through Fertility UK, they have a longer period of like you said it was something like 8 or 9 days. So obviously conservative estimates
mm,
or just the conservative interpretation of your chart to ensure
yeah,
that you're not engaging in unprotected sex during any day that you're fertile. But you
yeah.
also mentioned that when you first learned, you didn't feel that you had as complete of an understanding of cervical mucus as you did after you actually learned through the organization. So I wanted
Yeah.
to kind of ask you about you know, what do you think are the benefits of actually learning through an educator and how did it help you interpret the cervical fluid better?
I think seeing lots of pictures helped, and I think understanding the physiological changes behind it, and even seeing some of those, like like my beautiful cervix, those sort of style of photos, which are initially like, oh, it's some okay.
Are you talking about the
So
My Beautiful Cervix project online?
you've got it on your website, have you? The
Yes, I just want to make sure so I can link to the right link in the show notes.
Yeah, yeah. Because I mean, they are down the, speculum and torch route, which is fine, if that's what you want to do. Um, but so yes, how did it help me actually getting? Yeah, basically it was learning the background, what hormonal changes were going on, and it was, seeing the pictures and stuff. And I think for women working with someone, it can just be all those embarrassing questions. Well, not embarrassing, but those questions about, what's the difference between arousal fluid and egg white cervical fluid. What about if I get a bit of cervical fluid just before my period? Because we have this message of all cervical fluid is potentially fertile. It's like, well, no, it's only potentially fertile until you've confirmed ovulation. If you get anything later on, then that's because your hormones are, just maybe your progesterone's dropped a bit, and that's because things have changed slightly, you might get a bit more cervical fluid just before your period. And it's all those little things that might freak someone out if they were doing it on their own, can be helpful to talk about with an educator. But a lot of women will just want to read about it as well. So, but yeah, for me, I think. that helped, and I hope for the women that I worked with as well, it's just getting into the nitty gritty, and also, things like, when you go to the bathroom, it's more likely to be obvious after a bowel movement, which, it's, it's
Mm-hmm.
not the easiest thing to be talking about, but it's kind of like, I think it's more comfortable to talk about that kind of thing sometimes face to face, one to one. And I think also there's, in terms of just your question about, what's different with working with an educator. I think it's people. I tend to. So I work with women one to one, and I do, group work as well. Just, as I'm invited. I'm not necessarily very proactive at getting out there, but if I'm asked, then I'll go along to groups. And it's just being able to have someone there who has thought about this a lot and read about it a lot and learnt a lot, and then you can just fire whatever questions you want at them, rather than, you must read this at this time, because I think everybody comes with different questions. And so and that's what I think I feel like I add, because it can feel like it's a big leap. It's a big leap, using fertility awareness for lots of women. And if you want it to work really well, it can really help to have someone alongside you who's kind of, on your side and ready to, listen to all your concerns and your questions. And, they can fire you a chart, and they'll get back to you and talk about stuff. So yeah, it's that sort of, it's yeah, one-to-one support from someone who has a lot of experience and knowledge in the area.
Mm-hmm. Well, I can say I definitely benefited from that because as I've kind of examined my own learning process when I was learning the fertility awareness method, if I did read, my gateway drug into the fertility awareness method was was Tony Weschler's book. That was I went out to
Yeah.
the bookstore and I bought the copy and I read through the whole thing, devoured it, and started using it.
Mhm.
A few things I'll say about that. So when I first started using it, I was using it for birth control. I was in university. I was quite young, very early 20s. I was probably 19 or 20. And so I was not open to an unplanned pregnancy. And so arguably, I went beyond the conservative rules for
Mm,
the fertile window. And
mm,
so the vast majority of my preovulatory phase, there was rarely ever, I don't even know if I ever went fully unprotected during my preovulatory phase, to be honest. So I
yeah.
was actually being extra conservative. And part of that is because I didn't necessarily initially have a fertility awareness educator to really, again, like, so you can ask those questions, so you can speak to
Mhm.
someone who is has the experience of being able to explain to you what they do and how, all the little questions. Um, and I've heard that as well with some of the women who I interviewed. I know I interviewed Rose Uchuk a couple of times on the show, and she mentioned the same thing. Like, she was really overestimating her fertile window, which
Mm.
isn't necessarily a bad thing because I didn't have any unplanned pregnancies. But at the same time, you get a fuller, deeper understanding of the method when you're around women who have learned the method and who use the method.
Yeah. Yeah, I think this is a really interesting question. The thing about, whether, how conservative you are. And I think that every woman has to decide for themselves, really, how conservative they want to be. Because for some women, an unplanned pregnancy would just be a terrible, terrible thing that they would never want to experience. And in that scenario, then of course you're going to be going as conservative as you can. And you have to appreciate people's, you know, intentions, basically, how they feel about unplanned pregnancy. And I think, yeah, the pre-ovulatory phase can be, it is. I mean, as I might have noticed from my blog posts, I'd say that's the bit where I think we have to be quite careful, because if we just say, yeah, it's fine, you just, it's that is kind of like the like I say with my blog post, if you were going to color code it, so day one is I mean, the colours don't necessarily help because day one is blood, but it's not anyhow. But day one of your cycle, it's kind of like the amber phase in terms of safety, or avoiding pregnancy. And then you move into the red zone, which is like, your fertile window. And then it's only after you've confirmed ovulation that you're really in the green, utterly safe. I know I am utterly safe window. And of course, the very early part of your cycle, if you've got a history of continuous long cycles over 12 months of data that shows that you consistently have long cycles. You might have a very short number of days of bleeding. Say if you've only got a couple of days of bleeding, and you've confirmed that you always ovulate, quite late in your cycle, and you've done that through temperature and so on, and through calendar recordings, then, because I wouldn't use mucus on its own basically for the pre-ovulatory bit. I'd always use it alongside data and so on, I think. And if you look at the infographic in the Frank Herman article, it says it's quite nice about saying it's either you see some cervical fluid, or it's after, I forgot what it says. Might have to get it up on my thing, but it's very clear you don't just rely on cervical fluid. It's one that you use alongside other calculations basically. So
well, I think that
yeah.
that's one of the places where it's helpful to have somebody to really, because every woman is different, and these days a lot of women do have different health challenges that do show up in their charts. So if a woman has the type of cycle where or if she's having, first of all, it's not healthy to have mucus every day. So if a woman has some sort of mucus coming out of her vagina every single day, that's generally outside of the realm of healthy.
Yeah.
It's obviously something that does occur.
Yeah.
It's something that occurs more typically when a woman is breastfeeding, and that actually can be normal within that period of time. But obviously, if you're not breastfeeding, it's not typically healthy to have continuous mucus. But in that sense, if that's something that a woman notices, where every single day of her cycle, she never has a day that is dry. She's always observing something that she can actually touch, pick up. There's always something there, and there's a difference. It's not wetness. It's actually a sort of mucus. So that's something that you can work with a fertility awareness educator with to learn how to actually chart successfully, even if you have that type of observation. That's not something that you're really going to get a handle on from reading a book,
Mm.
and by yourself, because this is the fertility awareness method is a skill. And I think that I benefited not only from, learning through the Justice program, but I benefited from being part of a group of women who met on a monthly basis. We would teach other women. So women would come in and learn, and we would do introductory sessions. Women would come in after they've been charting for a few months, and they'd have specific questions about their charts. So you'd have a room with 5, 10 women. It was often on a smaller scale, quite intimate setting. And,
Mm-hmm.
I learned from, her experience, and we all learn from each other. And having someone who has the solid foundation of the education, more things come up in those types of settings than you could ever really write about in a book. And you can
Yeah.
have your specific questions addressed. So I think those are situations where if a woman is having a difficult time because she's always observing something, uh, it's if you don't seek help, you might just say, well, this method isn't going to work because it's telling me that I can never have sex.
Mm. Yeah. Yeah. I think yeah, it's true. But then we don't want to oversell it
But
either. It's kind of yeah, it's interesting really, because I think some women, yeah, it can feel like a bit of oh God, you mean the green zone is only like the final third of the cycle? That's a bit rubbish. And so if somebody's wanting to use it in that very conservative way, that might be another reason that actually fertility awareness might not work out for them. if there's someone who wants to, have a kind of like really, really low risk approach. But then that first bit can, and say if they've got, it just depends women to women. I really like what you're saying about, that sort of the peer support supplemented by someone with a little bit more training and stuff, I think is a really good model.
Mm-hmm.
And with the NHS, in the UK, there's group sessions, but they're kind of, well, in London there's like sort of lecture style group sessions, and then you can get one-to-one support afterwards. But I don't know how many women that suits, to be honest. I think that's quite a small number of women. And, the women that I see,
Mm-hmm.
this is kind of like another step beyond in terms of, being a quite small group of women who are prepared to, learn things in that much depth.
Mm-hmm.
And I think it's great that, there are trained practitioners around, but I wouldn't want anyone to think that that's the only way to learn either. It's, maybe I'm being too liberal here, but it's kind of, yeah, there's something about making it accessible,
Well, I
which,
agree with you because I recognize that going and getting that level of education is not for everybody. I think that it's something that I like to incorporate into the interviews that I do, especially when I'm interviewing fertility awareness educators, because I guess I want the idea to be out there that it's really not useless. It's not a waste of
yeah,
money
absolutely.
because you can actually learn quite a bit. And anyone who learns from a book, there's something that you will learn from an educator that you wouldn't know. But with that being said, it really depends on the woman. I
Yeah.
really think that it's important if a woman has cycles that are not straightforward, not
Hmm.
only to have that additional layer of confidence to be able to interpret something that's not just straightforward, because that's another level of difficulty,
Hmm.
but also if you are having, for example, continuous mucus.
Hmm.
This is just one example. There's lots of different reasons that could cause something like that. So by no means am I giving like the diagnosis here. But let's say, for example, that a woman has some sort of like cervical infection or some sort of yeast infection or ongoing low grade yeast infection. If you work with an educator who looks at your chart and says, hey, like we can work with this, but this is falling outside of the range of normal. There are women who work with educators who have these long, challenging cycles, who, through their work with the educator, through their work with their health practitioners, can actually improve the health of their cycles. So instead of just dealing with it, you're
Mm.
actually working towards getting your cycle to a more healthy and robust place. So
Yeah.
maybe in 6 months, you don't have a cycle of 54 days with all this random mucus. Maybe your cycles have gotten down to 36 days, and you actually have dry days now in the preovulatory phase because you've worked with somebody who's been able to identify what was causing that discrepancy in the first place.
Yeah. Yeah, that's a good point actually, which I didn't cover at all earlier. I just said, yeah, sorry, bye. If somebody's got any,
You're screwed. There's nothing you can do.
you're doomed. Um, no, and I have worked with women who've had troublesome cycles, and it's really simple. Well, it's simple, easier said than done, of course. But stuff around all the bog standard things that everybody knows about. Cut down on sugar, eat loads of vegetables, make sure you get enough sleep, exercise, look after your mental health, take a multivitamin. All these boring but essential things can actually really help a woman's menstrual cycle, and because like you say, it's part of their it's an essential health indicator, and if you're not getting a regular period, then there probably is something going on. And a lot of the time, health style, those sort of lifestyle changes can help, but sometimes women will need medication, and as the continual cervical fluid can be a sign of hypothyroidism and underactive thyroid, and
Mhm.
that's something that you can get medication for, as well as doing all the lifestyle things that can help it as well. And there'll be other things. So it's something about, yes, encouraging and helping women to do stuff they need to do to keep healthy, and then also referring them on if things just look very unhealthy, and hopefully they'll have a sympathetic practitioner, a doctor or nurse who will look into things and investigate what's going on, basically. And like you say, it can be, I don't know, bone problems or all sorts of different things. And so yeah.
Mm-hmm. Well, and it's kind of a way of looking at your chart as a starting off point. So it's you hear about the fertility awareness method. You go off the pill when you're ready, or whatever hormonal contraceptive you're using, and then you're so excited you start charting, and then you see all this stuff that doesn't make sense.
Yeah.
And so it's good to know that that's a starting off point. It's not where your cycle is necessarily going to be, but
Mm.
it's obviously, this is something that is a process in the body. And obviously, if you change the way that you eat, or if you start replenishing your body's nutrients, whatever the case is, it's not going to happen tomorrow where all of a sudden everything is perfect. So,
Mm.
but it's helpful to know that how the chart can be used to help you, gain that health in your menstrual cycle. So I have a practical question for you. Practical in
Yeah.
terms of, there's often questions that I see and that I hear from women who, that period of time when your kind of fertile window is starting. So let's kind of dial back and talk more about like a cycle that falls kind of more within the normal range. So we have a
Yeah.
menstrual period, we have, some dry days, and then we have the start of the cervical mucus pattern
Mm-hmm.
that leads up to ovulation, and then we have our post-ovulatory phase. So for a woman who, kind of going back to what we were talking about of, identifying that fertile window, using this method for birth control, and being conservative, following the rules about how to determine if you're fertile or not. So, how do you speak to clients about identifying when they're in that fertile window? What are some things that you observe so that okay, today I'm fertile and yesterday I was not fertile, or, you know, those types of
So
things.
it's the presence of any cervical fluid, and in terms of and there are, I'm going back to the calendar thing to some extent, but if you have confirmed ovulation in your previous cycle through a temperature rise, and so you know that you're having a true period, then and also you've got cycle data, and you haven't had any cycles that are less than 26 days long, then you can be confident that the first 5 days of your cycle are safe. I'm saying safe in the amber way, not in the green zone, you're utterly safe way, because somebody might ovulate early, they might be sperm that lasts 7 days long. The likelihood is that if somebody was ovulating that early, their egg would not be developed enough to actually implant successfully. And so there's all sorts of things that would, and there's big studies that have been undertaken that mean that those first 5 days are good to go, basically. But if somebody has a periods that last, I don't know, 7 days or 6 days, and they're not happy with having period sex, or using sponges or whatever things, then that's not going to be that helpful to them. And so then, like you say, it's the with the classic thing where you're menstruating, dry days, and then your cervical fluid, your mucus starts. And so then the official thing is that you can have sex on alternate evenings. And if you have a dry day, you can have sex that evening, and then the next day you can't have sex, and then the day after that you can have sex again, so long as you've had a dry day. And so that will be helpful for some women. And then there's also the earliest temperature rise from the last 12 cycles, and taking 7 days away from that, and that can identify your first fertile day. So yeah, am I answering your question?
Yeah, yeah, no, you are. I think that a lot of women, when they first enter their fertile window and they start to see, cervical mucus that at the beginning of the cervical mucus cycle, you could call it, not everyone is gushing with egg white on the very first time they start observing cervical fluid. So a lot of women observe, small bits that are not that stretchy, maybe white,
Yeah.
maybe discolored, maybe sticky, maybe lotiony, whatever the case is. And
Yeah.
I've beaten this point down on the podcast, but often, women will look at that and think, okay, well, it's not really that fertile, because they think that the egg white is fertile, or the
Mm.
wet, slippery, some women don't have egg white, they just have wet, slippery fluid.
Yeah.
So they feel that that is what's fertile, and then anything that's not that is less fertile or not fertile. And so it's always something that I bring up, because I feel that it's important to know that the presence of any cervical mucus is an indication that you're moving towards ovulation.
Mm.
And so you can have a little bit of something. And as you mentioned, there's a lot of nuances to checking cervical fluid. So if you have a bowel movement, it pushes it out, because all of these the anus, the vagina, the urethra, they're all parallel. So when you're going to the bathroom and you're using those muscles, you're pushing this fluid out. And if you're not observing it, you might think, oh, I just had a little bit of whatever. But a
Mm.
little bit of whatever means that a little bit of cervical fluid means that you're within that cervical window, or
Yeah.
not cervical window. It means that you're within that fertile window. And that fertile window is the time when you're not to be having unprotected sex if you intend to prevent pregnancy.
Yeah.
So it goes back to what you said, and the blog post, which I'll have to link to the podcast show notes because we keep referring to it. But it's about really identifying what your intentions are, and
Mm.
really choosing, to follow those rules and to be conservative if your intention is to prevent pregnancy.
Yeah. Yeah, absolutely. And I think there's a lot of women who, um, you know, will use fertility awareness and their intentions are maybe not that strong. And, I've come across, one woman who's saying, it's Terry, my friend's just using a period tracker and she doesn't really know what she's doing and she's going to get pregnant. And I'm like, well, maybe she wants to. Maybe she, sometimes, um, you know, women, we all work in different ways, and sometimes you're just like, oh well, I'll just sort of quietly take a few risks because I'm kind of interested, and there's whole, or I would quite like to have a baby, and there's all these sort of grey area, isn't there? Because some of us are really like, right, that's it, enough with the babies, or no way do I want to get pregnant, and others will have a more relaxed attitude, and so yeah, yeah, those intentions are kind of not necessarily that clear cut.
Well, and they kind of change throughout your life. There's periods of
Mm.
your life where you're absolutely, one way, like I'm not open to pregnancy.
Yeah,
And then there's other periods of your life, we all have friends who, maybe they're not trying, but they're not really avoiding. And
yeah,
so, and that's okay depending on the woman, depending on the phase she is in her life. And that will determine how you use the method, how you interpret the information, and what you choose to do with it. And so that's why, with this method, it's, you got to have a little conversation, you got to have a little talk with yourself to really find out what it is that you truly want.
yeah,
And then, because it's really, you have to understand and interpret the information, and then you're the one that decides what you're going to do with it.
yeah, absolutely. That's one of the reasons that, I sort of was going on about abortion earlier, is because I think women who are using fertility awareness will have thought about what they would do if they got pregnant a lot more than a woman who is using a supposedly much more reliable method, because you have it hanging over you. It's like, oh, you're using such an unreliable method, you could get pregnant, and you're like, yeah, yeah, no, I know there's really good science behind this method and it works really well, but nevertheless, you will have had so many people saying that you will have thought about what you would do a bit more. And so, yeah, I think that's one of the reasons that I have, quite strong feelings about, women's access to abortion, because, I come across women who have thought about it a lot, or, experienced it, or whatever it might be. And so just having that as an option, even though, of course, all contraceptive methods fail, there's very few utterly reliable methods. And
Yeah,
and
if
at
you
least
can
with,
get pregnant after a vasectomy,
well, exactly, but
then
also,
small chance. But yeah, we have to understand that all methods have a method failure and a user failure. So there's different types of failure rates. But ultimately, for women who are using any type of birth control, but specifically, the fertility awareness method, but I would say any type of birth control method, absolutely women have to, I believe women need to have access to, plan B,
mm,
have access to abortions, and then let them decide what works for them, right? Because
yeah,
not every unplanned pregnancy is unwanted. And so,
exactly.
but not every unplanned pregnancy is wanted either. So, um, and and it's interesting because women who are using the fertility awareness method, they do have to have that conversation with themselves and know what they would do. But so does every woman, because there are women who take the birth control pill and get pregnant. There's a percentage method failure there.
Yeah, there is. But if you're told that this is the sensible method and the AA will be fine, you'll be fine. And, and women who get pregnant using a long-acting method like the injection or something,
Hmm.
and, if you're just told, oh, you're doing the sensible thing, it's really unlikely that you'll get pregnant. You won't be thinking about that so much. When I was taking the pill, I was, very good pill taker, took it every single day. And abortion didn't cross my mind. Pregnancy didn't cross my mind. It's just like, yep, that's sorted. I don't even have to think about it.
Yeah.
And so yeah, I'd agree. It's something. There's all methods have failure, but I think it's something that's, or maybe it's just me.
Well, I'd throw in there because being a long-term fertility awareness user, with barriers at times, but either way, I haven't been on a hormonal contraceptive for so long. Um, I can say that I was not worried like on a monthly basis. I wasn't worried. And part of there's two reasons for that. One of them is because I had a thorough understanding of the method. I believed and trusted in the scientific facts around it. So I wasn't being reckless. I actually only used it because I believed, and I still believe in the actual validity, the actual science. And because pregnancy wasn't an option for me for those certain periods of my life, I was very conservative in the way that I would use it. So instead of being worried, taking
Mm,
risks and being worried, I wouldn't
yeah,
take any risks, so that
yeah,
I had a very, very comfortable peace of mind. Like I slept very well at
mm,
night. So I took it upon myself to kind of learn to that degree. I, was very conservative in terms of following the rules, and I was very consistent in my observations and everything. And the reason I'm saying this is because I want women to know that it's possible to use this method and not be worried. It's
yeah,
possible if you understand the method and you really understand what your intentions are. It's very highly, highly effective, and to the point that you don't really, like I said, it never really crossed my mind. Like, okay, well, like on a monthly basis, like, could I be pregnant? Like, it really, it didn't, because I was doing exactly what I was supposed to be doing in order to achieve my desired outcome. So I just want to throw that out there for anyone who's listening that's like, I would just be so worried. And I've often said that I couldn't have used the pill because I would have been more worried on the pill. Because
yeah,
if I had taken my pill half an hour late, I would always be nervous. So I actually feel like I would have been nervous every month on the pill. And the fertility awareness method, I was quite comfortable.
yeah. I wouldn't want. Good. I'm glad to hear it. Yeah, I'd say definitely, in terms of peace of mind, I do have peace of mind using this method, and I hope that I've given peace of mind to all my clients as well, in terms of, because you can understand what's going on, and I do have that qualifier about the before ovulation bit being like the amber zone, and then after being green zone, but still, it is peace of mind, like you say, you're not having to worry about side effects. You're not having to worry, minor or major, and you can tell from the, physiological signs that it's really clear when you're fertile and when you're not, or it's clearer when you're maybe, yeah, there's a bit of fuzziness here and there, but then that's when you go for your conservative option and you're like, okay, I'm not going into the fuzzy zone in terms of am I fertile or aren't I. I'm just going to stick with the conservative rules, and I'm comfortable using my how I'm handling my fertile time. And so, yeah, that is peace of mind, which is what we want with our contraception, isn't it? So, so yeah, maybe I was overstating that a bit, but yeah.
Well, it's out of concern because you want women to be successful using
Yeah,
the
I want it
method.
to be successful. And
Yeah.
I think one of the things as well is, I suppose, it's that, the global perspective and the whole thing about, Ireland being so close to us. Well, you've got America next door with sorts of dodgy abortion. And so I suppose there's something about, yeah, just feeling for women who are in, really unfortunate, who have got an unplanned pregnancy and who need an abortion. And so, yeah.
Yeah, no, absolutely. Well, to bring the interview to a close, I have a couple final questions for today. So the first one is, what would you say is the biggest myth about fertility awareness that you would like to see corrected?
The biggest, I don't know, there's a different one, really, slightly different, just to sort of be slightly awkward. Well, I think there's a few, really. There's the biggest thing that I would like to see some research. I'd like to see more research done about sperm survival. I want somebody to nail this, because there's a difference between the sort of, the European line, which is 7 days, and then the US line, which is 5 days. And I want to see more research done on sperm survival. So that's because that's not a myth, but it's one of those things that if people are hearing different messages, it's unhelpful, basically.
Yeah, the answer to the question, how many days do sperm live in a woman's vagina?
Yeah.
Or
Can
in
somebody,
her cervix or wherever they are. They're in there.
yeah, hanging out.
Yeah.
So someone could nail that, please. And then, yeah, the myth that it doesn't work. That's the biggest myth, that it's ineffective, that it's too complicated, too difficult, and it doesn't work. Those are the sort of, yeah, too complicated and it doesn't work. Those are the things that I would like to see sorted out, really.
Mm-hmm.
Too
And
complicated doesn't work, but and it's to do with the length of the fertile time. So I think there's something around the messages that us as fertility awareness practitioners are giving out, not getting too enthusiastic and saying it's fine, you only have to abstain for 3 or 4 days a cycle, which I've seen in various places, and my heart sinks and I just go, no, that's not helping.
so that we have clear expectations, like you don't,
Yeah.
because just like you gave an example of a woman who would in kind of sway people to the it's negative, like, oh, you have to check your cervical fluid and that's nasty. And so
Mm.
she's swaying people against it. And so the same way a fertility awareness educator who obviously isn't addressing the accuracy of whatever they're talking about, if they're saying, oh, you only have to abstain for 3 days, it's really not that bad. You don't have to abstain or use alternative methods for 3 days. It's usually at least, it depends on the woman, it depends on her cycle, but
Yeah.
somewhere between 5, 7, 9, and it can be more, it can be 10 days.
Yeah.
It depends on your cycle. It depends on how healthy your cycles are. Blah blah blah. We talked a lot about
Yeah, it
that.
depends
So
on your intention, all that.
yeah,
Yeah.
exactly. So to have everyone speaking accurately and not kind of luring. That's such a bad word, uh, but I see
Yes.
your point because you can't minimize the fact that you will have a period of time in your cycle that's generally at least 7 days
Yeah.
or 9 days where you have to use some sort of alternate, whether you're abstaining or so. Yeah, I agree. Um,
Cool.
second question, what would you say is the biggest myth about fertility in general that you'd like to see corrected?
That women are fertile every day of their cycle. I just can't believe that that's still out there as a, or maybe it's going. I don't know. You kind of think, oh, maybe this one's fizzing out a little bit, fizzling out because of, you know, trackers and things, helping. But yeah, that one's really unhelpful.
Yeah, I think a lot of women still subscribe to it. I did a live talk the other day, and when I started talking about this stuff, I got the I posted it on the website. That was the episode 37. But it was really interesting because I started talking about this and I was like, have any of you heard of this before? And they were all like, no. So we still got a ways to go. Last question then. For a woman who is listening, who is currently on the pill, she doesn't want to get pregnant now. or she's on some sort of hormonal contraceptive, but she's thinking about pregnancy within the next 2 to 3 years. What advice, if any, would you give to her?
There's different approaches, I'd say. It's some fertility specialists will say if you want to get pregnant and you've been on the pill and you want to get pregnant, aim to get pregnant immediately after you come off the pill, because that's when you're most likely to ovulate. I found that quite surprising advice, but that is advice that is out there. I think, but it depends on the woman, but I think it can actually be helpful for some women to think about maybe using fertility awareness so that they can, if they're happy handling their fertile time, so that they can understand when they're fertile and when they're not. And so when it comes to getting pregnant, they're not going to be stressing so much, because they'll have been able to check out their cycles, see if they're having regular cycles, see if things seem healthy, rather than just going for it the month after they stop taking the pill. So yeah, if you're planning getting pregnant in the next few years, I would consider using a non-hormonal method. At the very least, using condoms. But condoms plus fertility awareness, or whatever you want to use plus fertility awareness, I would recommend. Yeah.
Well, I think that's a great note to end on. Well, Sarah, thank you so much for being here today. I really appreciate you taking the time to come on the show and share your knowledge and your wisdom and your experience with the audience. And so, how can our listeners learn more about you, contact you, social media, your website? Maybe you can give your website information, everything.
Okay. Well, thanks for having me on this show. I really enjoyed that. It was good. So I'm on Twitter, Sarah Panzetta, at BF Aware. Website is befertilityaware.co.uk, and I'm sure there's going to be links underneath this podcast. And just get in touch if you want to ask any questions, or if you're in London or near London, then ask away.
Okay, great. Well, I'll definitely link to some of the resources we talked about today, as well as your website and your online presence there. And so, thanks again, Sarah. It was fun. It was really a lot of fun talking with you and talking all things fertility awareness today.
You too. Thanks very much.
Thank you for listening. If you enjoyed today's show, please share it with a friend. I'd love to hear your thoughts on today's episode. So head over to the show notes page for today's show and let me know what you found most helpful from the discussion that Sarah and I had about cervical fluid. So you can find the show notes page for today's episode at fertilityfriday.com/48. So the number 48. And you can find me on Facebook at facebook.com/fertilityfridays with an S. You can find me on Twitter at Fertile Friday. And if you enjoyed what you heard today, head over to fertilityfriday.com/community to be redirected to the Fertility Friday Fertility Awareness Facebook group. And if you've been enjoying the podcast, please look for it on iTunes and leave a 5-star review so that more people can find it. Of course, leave an honest review. I really appreciate you taking the time to let me know how I'm doing and let me know if you're enjoying the show. And I do appreciate all of you for taking the time to tune into the podcast wherever you are. So if you're on the go, if you're at home, if you're sitting at work or wherever you are, I do appreciate you taking the time to hang out with me and listen to the show and support the show. So thanks again. And as always, until next time, be well and happy charting.